Good to have you join us for another episode of Gist Nigeria, brought to you by the BBC and Channels Television. Here we track stories online, in the news, and unpack what they mean for everyday Nigerians. I am Sarah Ayeku. We begin with our top story. Prostate cancer is one of the leading causes of cancer deaths among Nigerian men, yet many only discover it when it is already too late. In this story, Gist Nigeria's Mercy Frank examines the prostate cancer crisis through lives it has upended and gaps that continue to cost many more Nigerian men their lives.
A predator stalking in silence, claiming the lives of more Nigerian men than any other malignancy.
I've treated a patient whose great-grandfather, the grandfather, and the father has it, and I also diagnosed him to have it.
If there is anything that I would love to do, is to save more men from dying early like my father.
Experts say it begins in the prostate, a small walnut-sized gland that sits just below a man's bladder.
And it houses the urethra, which is the urine pipe through which urine leaves the bladder to come to the outside. So that is the prostate, and when cancer occurs in it, then that is what we call prostate cancer.
Data from World Cancer Research Fund indicates that prostate cancer is the fourth most common cancer worldwide, the second most common cancer in men after lung cancer.
It is very, very, very common amongst black Nigerians inclusive.
In the year 2022, there were 18,000 plus men that were diagnosed, and out of that, there are about 11,000 plus death.
Because patients do present late and are not amenable for curative treatment options.
Real people make up the statistics. Chinwe Eseni's 60-year-old father became victim of a disease he couldn't name until it was too late.
It was when we noticed that it was affecting his bones, that he couldn't walk, was having challenges walking, that he couldn't do it again, and he opened up.
Chinwe says being the caregiver was like watching a mountain crumble and being unable to catch the stones.
That he started crying and wailing. There's nothing he did not call God that particular day. I cannot suffer like this, and my children cannot suffer like this. God, I want to rest. He came back to Lagos, and he went to Enugu after the treatment. That was how he passed.
Dr. Mohammed Balarabe's story began 10 years ago, shortly after his 50th birthday.
I go to Basgori a lot. So when I go, I meet doctors. They do biopsy for me, they diagnose a cancer.
Though now cancer-free, Dr. Mohammed, a husband of 2 wives and father of 7 children, says he almost didn't make it.
Take me under one injection is costly. It's about 300,000 per one. I did it for 10 months. I did a lot of tests. That test more per one test. I spent about 100,000.
In the hustle and bustle of Lagos, Nigeria's commercial hub, is this anonymous warrior who got diagnosed 15 years ago after his 40th birthday.
I never screened, I never thought about it because I said I was young and it's for the elderly.
3 men, different generations, kilometers apart, connected by a common silent hostile guest that devours long after making itself feel at home. To understand why the prostate cancer alarm comes too late for many Nigerian men, Gist Nigeria took the conversations to the streets.
Prostate cancer is a disease that affected the bladder. It affects the urinary tract and other, and it's incurable.
Nowadays, it can happen to across every age.
It affects their reproductive system.
Medical experts provide some clarity.
Cancer of the prostate, just like cancers in other parts of the body, usually does not disturb or manifest with any symptoms in the initial phase. And this is the stage we call asymptomatic phase, and these are the phases where cancer can be picked by screening.
Someone may be seeing blood in his urine, sometimes blood in the semen, something we call hemospermia, and it may also advance to cause blockage of the urinary pathway.
Once you start having unilateral asymmetrical leg swelling, most likely you have a pathology ongoing in your prostate. When you start having bone pain, these are all signs of the fact that this cancer has spread beyond the prostate.
The experts also emphasized that prostate cancer is no longer grandfather's disease.
I have seen prostate cancer in just about 3 persons below 40 years. In those age groups, is a very, very aggressive tumor.
We've also seen a family where 2, 3, or 4 men in the same nuclear family are afflicted by this.
People who takes a lot of fat, saturated fat, high protein diet, all right, are more at risk of developing prostate cancer than those who take more of vegetables.
The mining activity in maybe Zamfara or Sokoto are on the rise, and there is expectation that people working in that area are exposed to chemicals and radiations that will increase their chances of cancer.
Since the prostate sits on a part of the body that many men would rather not discuss, diagnosis often feels like an attack on their very identity.
We have tagged being a man or masculinity as being invincible. It's not.
Market research indicates that many cancer treatment materials are not locally manufactured, so prices are tied to ever-changing foreign exchange rates. And in the country where most households live without health insurance, the burden is long-term and extremely expensive beyond the financial capacity of most patients.
We screen roughly 2,700, 1,000 people a year, so 8,000 have been screened. About 498 have been found positive. Then out of these positive, about 108 we've considered them being poor, cannot afford to pay the doctors. It costs about 650 to 750,000 to care for each one when we take them to the urologist.
Experts also say the gulf between patients in need and available treatment centers is staggeringly wide.
Facilities for these treatments are often not available in our environment.
For radiotherapy, we have 3 centers that I often refer persons to. For robotic surgery, about 3 of them are available in Lagos. We don't have anyone in the whole of Southeast.
LUT has the best radiotherapy center, not only in Nigeria, but in West Africa sub-region. University College Hospital also has a cancer center, but of course not as developed as what we have in LUT.
For the population-based cancer registries, we have there about 13, and we have hospital-based registry there about 22.
But if cost, access, and late detection are driving this crisis, what can be done to change the story?
What I will recommend to men that please let's imbibe the culture of health-seeking behavior.
We should have a policy that will probably push persons to go and do screening.
Government also needs to do more by encouraging and making free screening available.
What women should do is to encourage the husband to do the PSA test. You can use it as birthday gift for them.
For an illness that could cost up to 30 million naira to treat, depending on the severity of the diagnosis, there are dangerous narratives about prostate cancer that are leading many Nigerian men, like sheep, to the slaughter.
The lack of sex can cause it. So at least as for a man, so we need to ejaculate 21 days in a month.
It is a fallacy and a great misconception to think that frequent ejaculations prevents a man from developing prostate cancer. That does not happen, and science has not proven that.
A common tale that goes around is that prostate cancer is automatic death sentence.
Early diagnosis and early treatment pays. It can completely cure patients of the cancer.
Some say sexually transmitted infection or hepatitis cause prostate cancer.
It's not sexually transmitted. It's not related to those other infections. False.
One dangerous misconception is that no symptom means no prostate cancer.
And that is why one should go for screening. It is the screening that will bring out the problem that is yet to manifest.
Some fear that screening for prostate cancer is extremely painful and invasive.
The first screening test is just a blood test, is just the needle prick. The second is digital rectal examination, which is just insinuating the finger into the rectum. It is actually not painful, particularly with a well lubricated finger with silocaine gel or KY gel.
A worrisome belief is that herbal concoctions alone can cure prostate cancer.
There is no such drug or such drink or herbal medication that will make cancer to disappear. What will make cancer disappear is either you go to remove it or you put radiation on it in radiotherapy.
Some say a faith-saturated God forbid would shrink prostate cancer to zero.
Going to medical sciences to find out and to know what to do is part of your faith.
This is a line of another hadith in which the Prophet sallallahu alaihi wasallam said, "Tadawu ibadallah." O servants of Allah, look for medication.
Across Nigeria, a new breed of prostate cancer advocates is rising. Like Chinwe, who is carrying the story her father never got the chance to tell, to Dr. Mohammed, shattering the male stereotype and embracing vulnerability, and this anonymous warrior reaching younger men with a message he wishes he heard earlier.
When you see any sign of anything, take action immediately.
Medical experts and other stakeholders agree that the ultimate victory isn't just survival, but ensuring that no man has to fight prostate cancer alone or too late. Mercy Frank, Gist Nigeria.
Awareness and quick action will without doubt make the difference. Do you think enough is being done to protect men's health in Nigeria? Tell us what you think on X at Gist Nigeria TV. Would love to hear from you.